Lethal injection, the medical technology of execution. Capital punishment has long been a divisive topic in society, reflecting humanity's struggle with justice, morality, and the boundaries of state-sanctioned violence. Among the various methods of execution that have emerged over centuries, lethal injection represents the most recent shift, a so-called modern attempt to make capital punishment more humane. This video delves into the history, ethical dilemmas, and systemic challenges that surround lethal injection, offering critical perspectives for criminal justice students seeking a deeper understanding of this controversial practice. Throughout history, society has devised numerous methods to carry out state-sanctioned executions, each reflecting the norms and values of its time. Public hangings, guillotine beheadings, and death by firing squad were once standard means of execution, methods intended to punish criminals and act as harsh deterrents in highly public settings. However, as societies evolved and sensibilities shifted, these executions began to feel barbaric in both their brutality and their spectacle. The introduction of the electric chair in the 19th century marked a technological leap. Touted as a faster and more reliable method of execution, the electric chair sought to portray death as swift and relatively painless. Over time, however, the electric chair faced its own controversies due to high-profile cases of botched executions. It became clear that even this method failed to reconcile society's desire for humane deaths with the grisly reality of taking a life. In response to growing discomfort with the visible violence of prior methods, lethal injection emerged as an alternative. Introduced in the late 20th century, it was intended to provide a sanitized and clinical approach to execution. Yet, as we'll explore, lethal injection has proven to be no less ethically or practically complex than its predecessors. Lethal injection was first adopted in the United States in 1977 as a response to public demands for more humane methods of execution. Texas became the first state to use this method in 1982 with the execution of Charles Brooks, Jr. The procedure was quickly embraced by other states as it was perceived to be more palatable, a method that utilized medical technology, evoking a sense of precision and cleanliness. In 1997, China followed the United States in conducting executions via lethal injection, becoming the first country outside the U.S. to adopt the procedure. Since then, lethal injection has been legislated in several other countries, including Guatemala, the Philippines, and Taiwan. However, these countries have yet to carry out actual executions using the method, reflecting varying degrees of public and governmental hesitation. The framing of lethal injection as both efficient and minimally painful gave it an air of modernity that appealed to judicial systems seeking to maintain capital punishment while addressing growing criticism. However, as we'll see, this newfound sophistication brought a precarious set of challenges. The procedure of lethal injection, at face value, seems straightforward. A combination of chemical agents is delivered intravenously to induce death in 3 stages: sedation, paralysis, and cardiac arrest. Typically, 3 drugs are used: an anesthetic or sedative to render the subject unconscious, a paralytic agent to prevent movement, and a potassium solution to stop the heart. The process, on paper, appears clinical and controlled. It is often handled in a sterile room, designed to mimic operating theaters, creating an impression of extreme professionalism. However, in practice, the procedure is riddled with complexities. Issues such as incorrect dosages, improper handling of the drugs, or difficulty in finding suitable veins have led to numerous botched executions. These cases have sparked widespread controversy, raising the question of whether the method is as humane as it claims to be. One of the most debated aspects of lethal injection lies in the role of medical professionals, whose active involvement in the process raises significant ethical concerns. Healthcare providers are sworn to do no harm under the Hippocratic Oath, making their participation in an execution antithetical to the foundational principles of their profession. In some cases, doctors and nurses assigned to assist in executions find themselves caught between their medical training and their civic obligations. Often, states attempting to sidestep this challenge turn to untrained personnel to administer the injections, resulting in heightened risks of procedural failure. Moreover, There is significant debate over whether lethal injection truly minimizes suffering. Supporters argue the use of sedatives ensures a painless death. Critics, however, point to reports of individuals regaining consciousness midway through the procedure, experiencing excruciating pain while paralyzed and unable to communicate. These failures shed light on the controversial impacts of relying on untested or poorly regulated drug protocols. Lethal injection is seen by many as an attempt to sanitize the act of execution. Its reliance on medical practices gives it a veneer of legitimacy and civility, reinforcing the perception that it is a humane alternative to earlier methods. However, critics argue that this sanitization masks the inherent violence of state-sanctioned killing. By hiding its brutality under the guise of science and technology, lethal injection arguably anesthetizes society's moral sensibilities toward the death penalty. Moreover, the framing of lethal injection as a medical procedure affects public perception of executions. Its clinical setting, a stark departure from the grim images of hangings or the electric chair, invites less scrutiny and outrage. This may inadvertently desensitize society to the moral challenges of capital punishment. The implementation of lethal injection is fraught with legal and systemic hurdles. In recent years, several pharmaceutical companies have objected to their drugs being used in executions. Many refuse to supply sedatives or anesthetics for the purpose, citing ethical concerns, which has resulted in drug shortages. These shortages have forced states to experiment with untested substitutes, leading to highly publicized legal battles and failed executions. The judiciary has also faced pressure to reassess the constitutionality of lethal injection as a method of execution, with claimants arguing that flawed or improvised drug protocols violate the Eighth Amendment prohibition against cruel and unusual punishment. Adding to the challenges is the frequent lack of transparency in how drugs are sourced and administered. This secrecy fosters mistrust, particularly when botched executions occur, leaving both the criminal justice system and the public questioning its reliability. Although the United States remains the most prominent user of lethal injection, its global impact is noteworthy. As mentioned earlier, China joined the U.S. in adopting this method in 1997, marking the beginning of a slow worldwide shift toward its consideration. Yet, the hesitancy of countries like Guatemala, the Philippines, and Taiwan to carry out executions by lethal injection highlights the ongoing global debate around its use. Some countries have explored alternatives to lethal injection that align more closely with their cultural or political norms, while others have abolished the death penalty entirely. Globally, the method's adoption largely reflects a nation's cultural and political stance on capital punishment more broadly. A central theme surrounding lethal injection is its intimate connection to science and ethics. By integrating medical practices into an inherently punitive act, it raises profound questions about the collision of justice and technology. Should the advancements of medicine, a field built upon preserving and improving human life, be appropriated to serve the demands of judicial killing? And does this appropriation truly make the act less brutal, or does it simply redirect society's discomfort? Critics of lethal injection suggest it reflects a troubling pattern: the use of technology to polish the optics of controversial policies without addressing their root ethical implications. Proponents argue that lethal injection is a necessary modern compromise, allowing the justice system to enforce laws while minimizing unnecessary suffering. The reality lies somewhere in the tension between these opposing perspectives. Lethal injection serves as a sobering reminder of the complexity of capital punishment. While its introduction was aimed at making executions more humane, its implementation reveals deep systemic, ethical, and moral challenges. It operates at the intersection of justice and medicine, creating troubling questions about society's approach to state-sanctioned death. For criminal justice students, understanding lethal injection opens the doors to broader debates about the role of ethics in law enforcement, the reliability of state systems, and the balance between punishment and humanity. As this documentary illustrates, lethal injection is far more than a sterile method of execution. It is a vivid representation of our ongoing struggle to reconcile retribution with morality. The conversation around the death penalty will undoubtedly continue to evolve, but what remains clear is the imperative to critically examine every aspect of capital punishment before determining its place in a just society. What do we gain and what do we lose in the pursuit of civilized execution? That is a question worth exploring further.